Hello students, in this video lecture we are going to discuss about the blood pressure. It is also called the arterial blood pressure, or in short it is known as BP. It is defined as the pressure which extended on the wall of arteries when the blood is flowing through the arteries. You know that uh, blood is also known as the river of our body, and that blood flow through the blood capillaries, blood vessels, blood artery and blood veins. These during that blood extend the pressure on the wall of arteries, veins, venules, arterioles. That pressure is known as the blood pressure. The blood pressure may be two types. One is systolic pressure and another one is diastolic pressure. Systolic pressure, this is a maximum pressure which is extended in the arteries during the systole of heart when your heart is contracting, when heart muscles are contracting. At the time जो pressure generate होता है, that is called systolic pressure. That having the normal value of 120 mm of Hg, that may be extend from 110 to 140 mm of Hg. Another term is diastolic pressure. It is a pressure uh, in the arteries during the diastole of heart. When your heart is diastole, when your heart is relaxing condition, at the time pressure in the artery is known as diastolic pressure. The normal value is 80 mm of Hg, that may be extend up to 60 to 80 mm of Hg. And another term we are using here, that is pulse pressure. Pulse pressure is difference between the systolic and diastolic pressure. The normal value of pulse pressure is near about 40 mm of Hg. Now we are discussing which factors that can affect your BP or blood pressure. These are these factors may be classified into two categories. One is cardinal, or also can the central factors. In the central factors, we are discussing the factors which are directly relate with the heart, and these are: one is cardiac output. If the cardiac output is greater, then your blood pressure must be uh, then your blood pressure may be great. Means if your blood pressure increase, then if your cardiac output is increased, then your blood pressure is directly increase. Another one is heart rate. Heart rate, in the vice versa, if your heart rate is decrease, that may cause if you are in the relaxing condition, ultimately your BP is slow down. At the time your heart rate is increase. If your BP is higher, then your heart will uh, vice versa, or it control the BP by its defense mechanism, and your heart rate will be decrease. So we can say your heart rate is irreversible proportional to the BP. Next we are discussing about the another factors. These we are called peripheral factors. These peripheral factors are factors which are affect your BP, and these are not directly related with the heart. uh, in this category, the first category is arterial blood pressure is directly proportional to the peripheral resistance. Means your BP is directly proportional to venous return, blood volume, diastolic volume, viscosity of blood, and that can either these things are in greater. If these things are in great response, then your BP will be higher. Okay, the next is arterial BP is inversely proportional to the elasticity of blood vessels, diameter of blood vessels, and the end systolic volume. Okay, if vasoconstriction is occur, your BP will be high, and if vasodilation is there, then your blood pressure is low. Okay, Then now we are discussing about how your blood pressure is regulated. Your pressure is regulated in by the two mechanism. One here we are discussing that first is by the nervous system. Both in this situation your vasomotor centers regulate the BP by receiving impulse from the different part of body. If suppose if your BP increase, that stimulate the cardiac or aortic baroreceptors. Baroreceptors are those are mostly situated in your greater arteries such as aorta, cardiac, carotid artery, etc. Okay, that stimulation received by the sensory nerve fibers, and that sensory nerve fibers stimulate the vasodilator area of vasomotor center. Vasomotor center which is located in the relay station of medulla of Langerhans pons. That stimulation of vasodilator area inhibit the vasoconstriction area of vasomotor center. That reduction in vasomotor tone the result in the vasodilation of blood vessels that reduce the peripheral resistance. Eventually that resistance will be reduced, that may cause your pressure will be low down, that may be reduce the blood pressure. This mechanism is maintained by the nervous system normally. And another mechanism that we are called the renin-angiotensin pathway. This is very important as per your exam of view. In this, the decrease of blood pressure that may cause hypoxia, means lack of oxygen in the kidney, stimulate juxtaglomerulus apparatus that is located in your kidney, and juxtaglomerulus apparatus release renin. Renin is a hormone that is released by glomerulus apparatus of kidney. That renin may cause angiotensinogen which is present in our body, that is that is produced and secreted by the liver. That angiotensin in the presence of renin converted in angiotensin first, and that angiotensin first converted into the angiotensin second in the presence of angiotensin converting enzyme. Angiotensin second then the secretion of stimulate the secretion of aldosterone from the adrenal cortex, that is the part of kidney. Aldosterone may cause the vasoconstriction, and in another parameter it may cause retain of water and sodium by the loop of Henle in the that is also the part of kidney. And the vasoconstriction and retention of water and sodium may increase your BP. That mechanism is regulated by your body, that is called renin angiotensin aldosterone pathway or renin angiotensin mechanism. Okay, here we are discussing some another important points such as baroreceptors are located in the carotid sinus, common carotid artery and arch of aorta, play important role in impulse generation. Next one is sphygmomanometer is the BP measuring instrument, and you may also remember that during the measurement of BP by auscultation, the stethoscope are placed on the brachial artery mostly, and the sound produced during measuring BP is known as cough sound. Okay, this is all about blood pressure. If you have any doubt, you can ask me anytime. Thank you very much, class. Thank you.